All right, this segment is sponsored by the Springfield Clinic. We have Dr. Taylor Tennill over at the Springfield Clinic Dermatology Department. Dr. Tennill, thank you for being here today.
Thank you for having me.
Winter.
Yes.
Winter is wreaking havoc on a lot of people's skin. Talk to me a little bit, why does winter just have these effects on our skin? I mean, from dry and flaky especially. I mean, what's going on as far as the weather goes and how it impacts our skin?
So the main thing is just the lack of, low humidity in the winter and therefore low moisturization. As a consequence, our skin, suffers the consequences.
Yeah. Okay, so for me, I use a bunch of shea butter in the morning. I just lather it up in the morning. Talk to me about some of the products that you might suggest some of your patients use during the winter months.
So some of the moisturizers I prefer are things like Cetaphil, Vanicream, or CeraVe. They're great moisturizers. They're fragrance-free, which is a key to a good moisturizer. They're also non-comedogenic, which means that they're not acne-prone. So those are some great options.
Gotcha, gotcha. Now, when it comes to your skin, I mean, also it goes beyond water too. I mean, how else can somebody with damaged skin take care of your skin throughout the whole year? I mean, obviously it goes beyond winter and just drinking water. That's like a common thing. People just drink water, you'll be okay. What are some of the other ways you can do, other things you can do year long to help prevent, bad skin?
Yeah, that's a great question. Basically, in the products you're choosing, that's important. For example, soap, it's important to choose something that's really a good moisturizer, such as Dove. You want to avoid harsh soaps such as Dial, Ivory, Irish Springs. Those things really dry out our skin. Another good habit is taking lukewarm baths or showers. The longer you're in, like a warm, hot shower, it really starts to dry out the skin. So
when should I go and see a doctor? When should I go see you? When should I guess a bell ring off in my head that I need to go see you?
Well, when the skin gets real flaky, as you mentioned, sort of pink, red, and itchy, that's usually a time when you can try over-the-counter 1% hydrocortisone, and if that's not taking care of it, then I would seek a dermatologist's advice.
How about those exfoliating washes, like in the shower? I might put on those like beady washes. Are those good for the skin? I mean, how are they compared to the ones that are maybe creamier or less invasive, I would say, to the skin?
Yeah. Those are kind of patient dependent. I tend to steer patients away from those. Often they cause, I think, more harm than good. And using, the loofahs, well, potentially there's a lot of negatives from that more so than the positives.
Bacteria and stuff.
Yeah, it kind of, the moist environment, you can harbor different bacteria and things like that. It can be harsh to the skin, so I tend to say try to avoid them.
Keep it simple, right?
Exactly.
Keep it simple. All right. Thank you so much, Dr. Tennill.
Yeah, thank you for having me.
All right, we'll be right back.